Good evening, dear viewers, and welcome to a new episode of Medical Talk, the program that brings you closer to the world of modern medicine and the latest in eye care and surgery. Our eyes are our windows to life, yet over time they face many challenges that affect how we see the world around us. From cataract, which causes a gradual clouding of vision, to laser vision correction, which gives freedom from glasses and contact lenses. Advances in ophthalmology today are helping millions regain clear, healthy sight. To discuss these two important topics, we are honored to have with us Dr. Wadha Ajeel Alsaadoun, cornea and refractive surgery senior specialist, who will share her expertise on the latest technologies and safe options available for eye patients today. Stay with us. You are watching Medical Talk. Welcome back. We're happy to have with us in the studio Dr. Wadha Ajeel Alsaadoun, a cornea and refractive surgery senior specialist. Dr. Wadha, welcome to Medical Talk.
Thank you, Dr. Mohammed.
Thank you so much. Let's go with the basics. So what exactly is cataract and how does it affect vision?
So this is actually the most common question that I encounter in my clinic. We are born with transparent lenses. These lenses focus the light into our retina so that we can see the image clearly. With aging, this transparent lens becomes more cloudy, and then here the patient comes with cloudiness of vision. I always tell my patient this is a normal aging process, like growing gray hair. Our lenses become cloudy, and then at that point, our vision will be affected.
Exactly. And what are the main causes of cataract, and what age do they usually begin to appear?
Okay, so actually, one of the first and most common causes is aging itself. And as I told you, it's a normal aging process, as if we're growing gray hair. Other causes are like using chronic steroid drops, trauma, like having special types of diseases like diabetes mellitus, which actually accelerates the process of developing cataract.
So because the reason I ask this is because many people believe that cataract is only an age problem.
No, actually,
and it can also occur, but could it actually happen to younger patients?
Exactly. So as you said, age is the most common, and usually above age of 55, we do start to have cataractous changes in our lenses. But some pediatric patients or some newborns are born with cataract. This is actually abnormal and needs like immediate treatment to prevent amblyopia. So we do surgery on these newborns. It's abnormal to have it when we're young, newborns, but it happens.
How common are we talking
Like
about?
very infrequent, like we can say 1 in 8,000 approximately.
Okay, before I move on to my next question, usually for an adult it's easier to diagnose or to basically see there is a problem.
Yes.
How do you know for children?
So basically, now with our health system, as soon as the baby is born, he gets a good full examination. One part of the examination is examining the eye. They diagnose it by having abnormal reflex of the eye, like when we shine a light or an ophthalmoscope into the eye, we should get a red or a pink reflex. If we do get a white reflex, this means that there is a blockage. One of the causes is cataract, actually. Some people or some newborns get diagnosed later by the parents if they develop squint, or the parents see that their kids, they're concerned about their kids bringing their iPads or the phone very close to the eye, going very close to the TV. They notice that their vision is abnormal, then they bring them late. But usually it gets diagnosed very early, either by the examination itself or developing squint within the first few months of life.
Exactly. So when is surgeries recommended for cataract, and what are the latest surgical techniques being used today?
So actually, in pediatric age group, the sooner the better, because we need to remove this blockage for the normal development of the eye, so that the patient doesn't, or the child doesn't develop amblyopia. So here, for the child, the sooner the better, because it affects the development of the sight. For adults, whenever it's affecting the vision and affecting the normal activities of life, then we should get the cataract surgery done, because as we said, it's a simple procedure. It's under local anesthesia. It's very minimal surgical intervention. I tell my patient, like now with the latest technologies, it's ultrasound removing the cataract, it's sutureless, it is under topical anesthesia. It takes like 10 to 15 minutes to finish it. And then when we do the cataract, we do have many options for lenses to correct our vision and throw our glasses that we used to wear. Like most of the patients when they age, they need reading glasses, and then when they do have cataracts, then they're wearing even distance glasses. So when we do the cataract, we have modern lenses now, the multifocal lenses, where we can actually see in distance and near without even depending on glasses.
What kind of recovery and results can patient expect after cataract surgery?
So it's a minor surgery, okay. Most of the patient by the second day, if the optic nerve and the retina are healthy, then they see 6 the second day. We do have some precautions for the first week after surgery, but usually the recovery is a maximum of 7 to 10 days.
You mentioned it's done under local anesthesia. Do some patients elect to do it under general anesthesia?
So I do have patients that actually request general anesthesia. Some of them, when they come, like pediatrics is always under general anesthesia. Some people are claustrophobic and they don't like the drape being put on their faces. So these patients actually they know they're claustrophobic, and we do ask specific question about claustrophobia before going into the surgery. These patients we do, and patients who are anxious in the OT, in the operating theater. So that patients, if they ask, we can do. But I really don't recommend, because it's a minimal surgery with minimal sedation. With the topical anesthesia, they'll do great.
Especially when you mention it's only like 15 minutes procedure, so it's not worth to put you under general
Yes,
anesthesia.
and no pain during the procedure.
No pain. Okay, so speaking of pain, is there a pain afterward?
There's no pain either during the surgery or after the surgery. It's another common question, Dr. Mohammed, that the patient keep asking me, do I see what you do during the surgery? Actually, with the local anesthesia, they don't see what we're doing.
Because they're blocked, basically.
Exactly.
Yeah. That's the same thing happened to me when I did my LASIK surgery. I was told by my ophthalmologist that, look, you're not going to be able to see anything. Don't be alarmed. Don't be shocked, you know. And it's also, as you mentioned, it's a minor procedure. But it's surprisingly that you're saying that now there is no post-op pain, not to be mentioned, basically. Okay, Doctora, before we move on, you mentioned it's a sutureless procedure. Can you go back to that? Because it's quite fascinating. A lot of people, they think there are sutures.
Yes, exactly. So now with the revolution of cataract surgery, it was a big incision where they used to do extra cataract extraction. Now we do phaco procedure where we remove the cataract using ultrasound. Our incision is only 2.2 millimeters, which heals spontaneously without the need for sutures. So as I told you, like let's say sometimes we need to put sutures, like one in a few thousands, if they don't heal well because of diabetes. But in general, we don't need sutures in cataract surgery.
It's amazing because it's a minimal invasive procedure basically. And that's why most of the time we don't need to use sutures, and to help spontaneously heal.
Yes.
That's wonderful. We still have more questions to go, but we'll be right back. Stay with us. Welcome back. We're still talking in the studio to Dr. Wadha Alsaadoun. Dr. Wadha, before the break, we were talking about cataract. I want to shift the attention to the laser vision correction procedures. What exactly is the laser vision correction, and how does it help patients reduce or eliminate their need for glasses?
So many patients actually need the glasses to see well. They either have myopia, which is short-sightedness, or hyperopia, which is farsightedness, and they can have astigmatism too. We can remove or eliminate the need for the glasses by implanting these numbers on the cornea by doing laser vision correction. Laser vision correction has evolved and has many I want to say that we have many options of laser vision correction. We do have the traditional way of doing PRK, which is the superficial laser, to implant the laser on the cornea directly. Another advance on that, we do a flap, and we can correct the numbers under the flap, which is called LASIK, either done by a blade or done by femto-LASIK. The recent type of surgery is called femto-smile, where it corrects the vision within few seconds, actually.
Exactly. I'm glad that you mentioned those terms because different types of laser vision correction available right now, such as LASIK, PRK, and SMILE. How do they differ really? I mean, which one should I choose for myself, or will you choose for your patient?
Okay, so some patients actually come and they want the most recent and the most popular type of surgery. This is not the way that we choose our surgeries. I choose which surgery is good or fits the patient depending on the number of the glasses and depending on the corneal readings. I do a special test called topography. This gives me the curvature of the cornea and the thickness of the cornea. I have to make sure that the cornea is normal and accepts these numbers to be implanted on the cornea. So I choose basically what fits the cornea depending on the numbers and the topographic readings.
Some patients are afraid of the laser procedure itself, and they ask, like, how safe is modern laser surgeries or correction procedures? What kind of preoperative evaluation that you do to ensure the best results for the patients?
Yes. So actually it is a very safe procedure. It is one of the safest in medicine. I have done laser on my eyes.
Yeah,
actually.
Me too.
Yes, and it changed my life, and I do understand how it changes the life of my patients. Good study of the patient gives us the best results. We have to preoperatively evaluate everything. As I told you, we have to evaluate the numbers of the glasses, we have to evaluate the thickness of the cornea, we have to check the retina of the patient, and we have to evaluate dry eye. And if they do have dry eye preoperatively, it's better to be treated preoperatively to get the best results for the patient.
Exactly. Fix that first, and then we can, or the underlying condition, or if they have allergy or something like that. Are there specific conditions or eye types where laser correction should be avoided or postponed, and what are the other alternatives for laser vision correction?
Yes. So actually one of the things that let us postpone the surgery is having dry eye, where we need to treat it. Some patients, when they come to us to the clinic, they do have very high numbers of refractive error, and then they do have thin corneas. Here we don't have the space to work on the cornea by laser vision correction, but they do have other options. Like we do have a lens that we can implant in front of our original lens. It's called ICL. This ICL, we actually order it based on the numbers of refraction for the patient, where we implant it into the eye and the patient can see 6 weeks with the lens without touching the cornea, because as we said, the cornea is thin and we can't do any laser on it. So they do have the option of implanting a lens.
Okay, I only ask this question is because a lot of my patients who are, young adults, they ask, like, is there an age restriction for laser surgery? Do you recommend doing this, like, for, like, say 16, 17 years old patients, or is it recommended that they wait until they're 18 and above?
Yeah, so actually it's FDA approved after the age of 18. If the vision is stable, like if the patient brings me their glasses, or if they have been following up with me, I would know that the refractive error is stable. But if I see that the patient is 18, but still the number of the glasses are still changing, meaning the eye is still growing, I would wait until the age of 21. It's not because it can't be done, but it would be done more properly and to get the right number when the refractive error is stable at that time.
Exactly. Okay, so we talked about the different types of laser correction procedures. Let's talk about the recovery of each one of them, because each one of them has a specific program post-op procedure in terms of pain and complications. What are they?
Okay, so basically most of the procedures, they don't have intra or post-operative pain, except the PRK, which is the applying the laser directly to the cornea. However, sometimes we do need to do the PRK, although they do have pain after surgery, because it's the only surgery that maintains the integrity of a thin cornea. So if I see a thin cornea, then I do tell my patient, I know there is post-operative pain. However, we have to go through this surgery because it maintains the integrity of our cornea. And this is actually very important to maintain the results. And I do to explain to my patients that there is pain after, but the vision is exactly the same when compared by studies between SMILE, LASIK and PRK at 3 months point, all of them do have the same visual result. Regarding femto LASIK and SMILE, they don't have intraoperative pain, neither they have postoperative pain. So it's almost, when we go to the femto part, they don't have pain, but as I told you, we do need the older version of the laser vision correction, the PRK.
Whichever is basically suitable for that specific patient, for that specific case.
Exactly.
Does the vision stay constant after the surgery, or can it go back?
So actually, if the patient is studied well, and the vision was, or the refractive error was stable at the time of the surgery, now with modern laser, it should be stable lifelong. But a common misconception that when the patient needs readers at the age of 45, let's say, they think it's because of laser vision correction, and that's not right. It's basically because our lenses become lazy, and the patients at that point, they need readers to help them with reading. But this is not because of laser. Even if they don't do the laser, they'll still have this presbyopia effect.
So it's part of aging, basically. Exactly. It has nothing to do with the vision correction. Exactly. I want to ask one more question regarding stigmatism. Can it be done? Can it be corrected by laser?
So actually, with modern lasers, we can correct the astigmatism very well and with stable results. This is a big revolution in the modern lasers, because the previous types of lasers, they weren't able actually to treat astigmatism, and it was something that was like we can't treat. Now with modern laser, we can fully treat astigmatism.
So because, you know, I only ask this because some patients have both stigmatism and basically myopia or something like that, and the notion that you cannot fix stigmatism, but I'm glad that you mentioned that there is fully fixable. Now, in terms of dry eyes and taking care of your eye and good habits, bad habits, before we finish this interview, what would you say?
So actually, dry eye, most of us, we have dry eye, even if we didn't do laser vision correction. It's because of our modern life where we use lots of electronics. It's good to put warm compresses to stimulate our own glands or our own glands. It's also good to use preservative-free lubricating eye drops. There are many treatments, actually, options for treatment of dry eye. If we need, we can have like IPL laser to stimulate our glands, punctal plugs, many options, but we have to evaluate to decide what is better.
Well, Dr. Wadha Ajeel Alsaadoun, thank you so much for your time and for all the valuable information that you shared with us. We'll hopefully be able to host you again in Medical Talk. Thank you so much.
Thank you.
Dear viewers, we still have more to go. Stay with us. We'll be right back. Dear viewers, family health means more than treating illnesses. It's about living with awareness every day. Healthy habits, regular checkups, and good communication at home make all the difference for the stronger, healthier family. Let's move now to our family health tips.
Hello everyone, this is Hayat Al-Sayegh and I'm a clinical dietitian. Today I'll be talking to you about hydration. Now sometimes with nutrition we forget that water is a key element. A lot of times we don't realize how much water we need to be taking in, but hydration is really very important for your brain health, for your mood, and as well as your memory. Now for men, we're expecting them to take about 3.8 liters of water per day, which may sound like a lot, but in these warm temperatures here in Kuwait, this is actually the bare minimum. For women, now we're expecting them to have around 2.8 liters of water per day. Again, it may sound like it is a lot of water, but with these temperatures that we have over here and the heat, it really is our bare minimum. With water, it's actually not a one-size-fits-all. There are a lot of things that we need to take into consideration. Our physical activity, if we are exercising, how much sweat output we have when we are exercising, as well as how we're feeling. Days where we are sick and we do have high temperatures, the water intake actually needs to go up. And the 2.8 or the 3.8 liter is considered a bare minimum, and you need to be taking in more than that. Now, I know a lot of people are thinking, why do I need the water and why is it so important? So if you think of your kidneys, their purpose is to flush out toxins, and they really can't do that unless you are properly hydrated. And just a 1 or 2% decrease in hydration can actually alter the whole system, make you not feel well. You get into these mood swings, you have brain fog, and you're not actually retaining as much as you would think you really should be. Now, I know many people would complain they don't like drinking water. Well, the good news is you can take your water intake from a lot of things like fruits and vegetables. Things like watermelon, cantaloupe, and strawberries actually contain over 90% of water in them. And vegetables like cucumber, romaine lettuce, even bell peppers have a lot of water content in them. And if you eat them regularly with every single meal, you'll be ensuring that you are meeting your water requirements. And now it's really important to also realize that kids need water as well. They should be taking in around 1.3 to 2.3 liters, especially if they are going to school and they are, using their brain and using their memory. Now, we really hope you enjoyed today's episode, and we'll see you all soon.